Hi everyone, Nurse Inga here. Today I have the pleasure of recording a PowerPoint that was created by our MSN candidate, Jen Carangio. She did an excellent job presenting this in class, and I wanted to share it with you. We're going to be speaking about anxiety disorders. Anxiety is when a person feels discomfort, apprehension, or dread in relation to anticipating danger. Most of the time, the person doesn't even know what they are experiencing anxiety in relation to. So the source is usually nonspecific or unknown. When we know the source, oftentimes that's a phobia. Some key concepts related to anxiety. Hyperventilation may occur during periods of extreme anxiety, and our goal has to be to assist the client to concentrate on breathing slowly. It is very important to remember that we do not place plastic or paper bags or non-rebreathers without oxygen over the client's mouth and nose, because this can lead to hypoxic events. Instead, you can have the client take a few breaths into cupped hands or into a paper bag that is over the mouth only. The purpose of this is to have them concentrate on their breathing and to focus breathing slowly. The goal is not to have them rebreathe CO2. That has been shown by evidence to not be effective and to actually cause harm. When we're treating anxiety, we have to remember that patients who have mental health disorders, especially depression and anxiety, oftentimes will self-medicate. And so one good medication choice is Buspar or buspirone. And that's used for the long-term treatment of generalized anxiety disorder. It's a medication that's taken every day. The benefit is that it's not an addicting drug, such as benzodiazepines are. And this is a comical picture here, but the woman needs to take her anti-anxiety medication, but she's afraid to take them, which does happen. So a lot of times patients want to get off of their medication, so they will self-medicate with over-the-counter or other substances as well to control their symptoms. When we talk about anxiety, we have to talk about the wide range of symptoms and types of anxiety that are possible. The first is mild anxiety. And with mild anxiety, the person feels on alert. They can see, hear, and grasp ideas. They have a heightened awareness. They're able to work effectively alone or in a team. And this is good for things like prepping for your exam, public speaking, and a job interview. Normal anxiety motivates people. It actually makes you more productive. So normal anxiety can be a positive factor. As the person moves from mild to moderate anxiety, moderate anxiety causes a slight decrease in concentration. It becomes more difficult. They may need a little help focusing. They're still able to solve problems, but they can't really grasp entirely what's happening to them. So this might be, with mild anxiety, you have a week to prepare for people who are visiting. With moderate anxiety, they call and they say, we'll be there in an hour, and you're trying to clean your house or whatever it is. Or, you're trying to pay a bill and you can't come up with the money in time. A lot of people experience moderate anxiety on a regular basis related to work, related to social or personal lives. Related to finance and stress. Anxiety can become acute and kind of severe and even to the panic stage when the person starts to experience physiological symptoms. Hyperventilation, tachycardia, withdrawal from external stimuli, and rapid speech are signs of severe anxiety. The person may experience feelings of dread, confusion, and a sense of doom. At this point in time, they really can't focus on what is going on around them. During the panic phase, the person is unable to focus at all and they experience extreme terror. They may even have hallucinations or delusions, irrational reasoning, and they're experiencing kind of the full-blown fight or flight sympathetic response. If anxiety becomes chronic, we consider that pathological. And pathological chronic anxiety or recurrent severe anxiety can lead to medical problems. It can actually lead to chronic physical manifestations, heart disease, stroke, high blood pressure, high cholesterol, and high blood glucose from that chronic elevation of the fight or flight syndrome. A person who's experiencing a panic attack has the sudden onset of extreme apprehension or fear associated with feelings of impending doom. They may even say to you, I am going to die. They have this just overriding fear or terror and believe that they are going crazy or that they're having a heart attack. They experience very real mental and physical symptoms with this panic. It has a very sudden onset, but also it is usually fairly short in duration, lasting only a few minutes. It's treated with benzodiazepines, antidepressants such as our SSRIs and our TCAs. MAOIs are effective at treating panic disorder, and then behavioral and cognitive therapy as well. Clonazepam is one of the benzodiazepines that tends to work fairly effectively in the treatment of panic disorders. General anxiety disorder is often referred to as the worry disease. This is a chronic severe distress with associated cognitive dysfunction and impaired social functioning and poor health. The person often has major depression as well, and it may be related to a panic disorder, self-medication, alcohol, and substance abuse. Patients with general anxiety disorders oftentimes are treated with SSRIs or Buspar. Phobias are persistent, intense, irrational fears of a very specific object, activity, or situation that leads to avoidance of that stimulus. These can lead to impairment in social, occupational, and other areas of functioning when faced with the object or situation. Social anxiety disorder is a social phobia where the person experiences severe anxiety or fear provoked by exposure to a social situation or a performance situation, resulting in embarrassment or humiliation. So they have a fear of rejection. And this occurs with people who are afraid of public speaking, for example. Drugs like propranolol, which are beta blockers, are often very effective at treating social anxiety disorders and phobias because they help slow down the heart rate and stop that fight or flight response. So they block the epinephrine effects on the heart. MAOIs, SSRIs, cognitive therapy, and social skills training also help sometimes to alleviate phobias. A person with a phobia often recognizes that they have this fear and that it's excessive and unreasonable, but they're powerless to change it. Now let's talk a little bit about obsessions and compulsions. Patients with obsessions have intrusive thoughts that are recurrent and stressful. They know that their thoughts are irrational, but they continue to be repetitive and cannot be ignored. Obsessive thoughts create a great deal of anxiety and stress. To alleviate that anxiety or stress, compulsions occur, and these are repetitive ritualistic behaviors or mental acts that the individual feels driven to perform, which reduce the anxiety associated with the obsessive thoughts, such as frequent hand washing, checking to make sure that things are turned off, turning a door handle or a key a certain number of times or a certain number of directions. You know, everything relating to a certain number, like the number 3, things like that. So this ritualistic behavior oftentimes is very superstitious in nature, but the thought is that it will overcome or alleviate the anxiety. Obsessive compulsive disorder, or OCD, is an anxiety disorder that is neurologically based. It is related to Huntington's chorea, epilepsy, Sydenham's chorea, and brain trauma. The basal ganglia are also dysfunctional, which are responsible for complex motor activity. There is prefrontal hyperactivity, where the person tends to worry and plan excessively. The obsessions may seem senseless, but they cause anxiety, and the most common themes are fear of hurting a loved one or fear of contamination. The most common compulsions include hand washing, checking a door lock, counting, praying, or performing an act a specific number of times. OCD is often complicated with depression or substance abuse to help alleviate the anxiety. This disorder responds well to the treatment with SSRIs and tricyclic antidepressants. Body dysmorphic disorder, or BDD, is an imagined defective body part that becomes an obsession, and the person performs compulsive acts of checking, picking, and grooming. Normal social activities are impaired because they have this exaggerated belief that they have hideous physical flaws associated with their face, skin, genitals, thighs, hips, or hair. They often undergo plastic surgery without satisfaction or sense of improvement. Patients with body dysmorphic disorder have a very high successful rate of suicide. We also use SSRIs and TCAs to treat this anxiety disorder. Trichotillomania, the hair pulling disorder, is another anxiety disorder in which the person pulls out hair in response to tension or stress for a sense of release or gratification. The sites of hair pulling include the scalp, the eyebrows, and the eyelashes. It's usually pulled from the opposite side as the dominant hand, and you may see associated nail biting, head banging, scratching, self-biting, or other acts of self-harm. Hoarding is a new diagnosis in the DSM-5, referred to as compulsive hoarding. And this is excessive collecting of items and failure to discard items. This results in unsafe living conditions, social isolation, and disruption in ADLs or self-care. It includes retaining garbage, trash, broken items, old items, and things tend to be kept in piles. We cannot use beds, couches, chairs, tables, or the kitchen. It's very difficult to treat, and the person tends to have a very poor response to therapy or medication. Anxiety can be related to medical conditions as well. Certain respiratory, cardiac, endocrine, neurologic, and metabolic disorders can stimulate the fight or flight response, leading to anxiety-like sensations. When dealing with a patient who's experiencing anxiety, first ensure safety and check for any threats to life or limb. Always start with your, C and safety and then ABCs. Look for any alteration in hormones, electrolytes, or just kind of normal balance of the patient. It's important that you stay calm and stay with the patient and ensure their safety. Minimize stimulation to decrease distraction and stress. Use very clear, simple statements, repeat as necessary, try not to get frustrated, and understand that this could be very overwhelming. Use a low-pitched voice and speak slowly. Again, clear, simple statements. Reinforce reality and listen for themes in the things that the patient is saying to you. It could be that they are identifying their trigger in the things that they are saying to you. Attend to their physical and safety needs as they appear, and make sure that you're practicing good, safe, effective nursing care. If you have set limits and been very consistent yourself and across care providers, as well as you've provided outlets for tension and stress to the patient, and they still remain very much a risk to themselves or others, medication, so chemical restraints or even physical restraints, can be used as a last resort. When we're focusing on the patient and the outcomes, the things that we want the patient to work towards are identifying their anxiety, that feeling, and the triggers, the things that tend to cause that anxiety to be present. We want to encourage them to express their feelings and their concerns. Assist them with problem solving and encourage them to do problem solving, including coming up with some alternate solutions. This may be through role play or modeling behaviors. Discuss with them behaviors that have worked in the past and provide outlets for tension and energy so that it doesn't build. Again, anxiety disorders can have a very significant impact on the quality of a patient's life. Our goal is to help them identify those feelings, the causes, and the outlets to manage the anxiety while ensuring that the patient remains safe. Thanks for watching.